I'm here with my beautiful wife and baby back there in the GenEpic booth. So anyway, I am super excited to be presenting GenEpic to you all. We've had amazing clinical studies done on GenEpic in the US, in Japan, and in Malaysia, and now we're looking forward to introducing the product to the Philippines. Our goal is to recruit about 2,000 patients here for our Philippine-based clinical study. GenEpic, you guys, is a radically super simple approach to the treatment of cancer. In 2015, there were 2.1 million newly diagnosed cancer patients in the United States. So think about that. That's a 25% increase in just 5 years. Now, I know in the Philippines, I looked at some stats, your breast cancer rates are soaring here in the Philippines. I mean, the numbers are exponentially, they're growing 5 to 8% every year for newly diagnosed breast cancer patients. And I've got it broken down here between male and female, but guys, 2 million people a year for new cancer just in the United States. If we keep going at that rate, then 1 in 3 people in the next 50 years will be diagnosed with cancer in the United States. If we keep growing at that 25% every 5-year rate, it's insane. And of course, we all know what causes cancer. You know, it's a myriad of things. Carcinogens, right? That's what the word means for carcinoma. It's carcinogen. But who here is willing to change their lifestyle or their diet or move from Manila so you're not getting the pollution and all the carcinogens here? Who can do that? Nobody can, right? So there's not much we can do about the causes of cancer except your own personal responsibility. We've had lots of presentations here today about, you know, getting rid of the amalgams, cutting out the carcinogens. Think about your clothing, your deodorant, everything that basically you put on your body is a carcinogen, right? So yes, there are things you can do to I guess, prevent that by going all natural, eating a healthy diet, whatnot. But the stats don't change. The stats still say right now in the United States, 1 in 3 men will be diagnosed with prostate cancer by age 64. For women, it's 1 in 4 women will be diagnosed with breast cancer by age 65. So, you know, those are the stats. Not much we can do about it. But what is one thing that all cancer cells have in common? I don't care if it's a blastoma, a carcinoma, or a melanoma. Other than blood-borne cancers like lymphomas and leukemias, what do all these cells have in common? It's one thing, it says right down there at the bottom. In order for a cancer cell to replicate and divide, or in order for any cell for that matter to replicate and divide, it takes energy, ATP consumption. This is why GenEpic is so simple. It's the first FDA clinically studied, clinically proven natural ingredient, natural supplement to block the enzyme that converts ADP into ATP energy. And it does it in a completely natural way. We'll show you the clinical studies, the side effects, all of that stuff from it, which were virtually none, but let's move on. Everybody knows what ATP is, right? I don't need to explain this, I think. It's basically right down at the bottom. It is cellular energy. A cell cannot divide without ATP. So cancer cells grow rapidly because they consume copious amounts of ATP. In fact, the average cancer cell consumes about 5,000 times more ATP than your own body's cells, than a healthy cell, like a muscle cell. So I always tell patients you can liken a cancer cell to like a gas-guzzling SUV. Your gas-guzzling SUVs, you put 1 gallon of gas in it, you're only going to drive a few kilometers. Where your own body cells are like super hybrid economy cars. 1 gallon of gas, you can go 100 kilometers in it. So if we eliminate or if we cut the fuel, like if we stop shipping, you know, refined fuel to the Philippines, how many cars would be on the road in 1 year? None. You'd all be on bicycles, right? So if we cut the ATP supply to the cancer cells die. Your own body cells don't. I'll explain the mechanism later. But we can regulate ATP with something that you grow right here in the Philippines. You all know the durian, right? Okay. Acetogenins are found in the skin of the seed of the durian. The what? What is that? Oh, is that what you call durian? I guess they call, no? I can't hear you. Oh, soursop. Graviola. Oh, that's not the durian. Okay. Sorry. Well, we actually use the durian seed in our formula. But it's same as pawpaw, graviola, durian. They're all in the same family. What they contain is they contain an ingredient called ananaceous acetogenins. Yeah, do you know acetogenins? It's a phytochemical that we discovered back in the 1970s that blocks ATP to the cancer cell. These were done at the University of Purdue. There was a clinical study there done in 1977 that showed that use it for lice, really? Okay. All right, well, acetogenins are found in the seed. And basically what they do is they can inhibit ATP production within the cancer cell only. We'll get into the mechanism of action later. But there's been lots of clinical studies. Here's a clinical study in 2008 saying researchers, they're called ATP synthase inhibitors. They did lots of studies on cancer cells in vitro and in vivo. Here's how it works. This is why this is so simple. Cancer cells produce ATP energy from what pathway? I think we've all heard this, right? The glycogen pathways. In fact, you see all over the internet, people are saying, hey, stop eating sugar and you'll cure cancer. It's not true. It's not that it's true. Because glycogen can be produced not only from sugar consumption, but protein consumption as well, right? I mean, your body produces glycogen in several different pathways. The problem is, who can stop eating sugar? I mean, an orange, an apple, celery, broccoli, it's all carbohydrates, right? Bread, rice. So just by stopping eating sugar, you're not going to cure cancer. But cancer cells can only use glycogen as a source of nutrients to convert ATP energy. A healthy cell, we've got about 22 different pathways that a normal cell, through the mitochondrial activity, can produce energy. It can produce energy from oxygen, from glucose, from lots of different pathways. Cancer cells only have one pathway. It's a proton pump that uses an enzyme inside of it, converting ADP into ATP energy. So acetogenins, when we take Genepic, which contains high doses of acetogenins, we block that glucose pathway in the cancer cell. That's the only energy supply a cancer cell gets, so the cancer cell dies. Your normal cell still lives, because normal cells can produce energy via lots of different pathways. Here's more studies showing. We don't have a lot of time right now, so I'm not going to go over all of these in detail. Just know that there are many studies on acetogenins and their ATP inhibitive properties. The reason why this has not become a drug, like I said, back in 1977, we discovered that acetogenins block ATP synthase in the cancer cell. In fact, they found it to be 10,000 times more cytotoxic to cancer cells than andreomycin, which is, tamoxifen, the current breast cancer drug. But it didn't become a drug because there are over 300 known acetogenins. And they couldn't isolate which one it was, so they couldn't extract it and make it a novel compound. These studies were done by Merck, by the way. Merck Chemical Company couldn't patent it. And because they couldn't patent it, they stopped all the clinical studies. And yet, we know that acetogenins, and in all honesty, I don't care which of these it is. I mean, I've listed about 60 of them here. There's over 300. We're taking the pure acetogenins from the seed, and it's one of the active ingredients in GenEpic. And again, we'll show you the results of the clinical studies in just a bit. So here's the first clinical study we did. Actually, it wasn't the first. It was the first in the United States. We took 60 patients under a phase 2 FDA-approved IRB in the United States. And these were, let me get you the results. We gave them 2 packets of GenEpic, one in the morning, one in the afternoon. I'll show you the results in a graph in the next slides, but it was a 12-month study on prostate cancer. 60 patients, each took GenEpic for 12 months, 2 times a day. We took their PSA scores, their Gleason grade, and then we asked them about side effects. The average PSA score dropped from 10 on average in the 60 patients to 1.48 in the 12 months. Most of the PSA dropped in 3 or 4 months, but it was a 12-month study, so we have to give you the 12-month averages. The average Gleason grade was a 6.5. If you don't know what Gleason score is, I'll explain that a little bit later, to a 0.33, in other words, basically cancer-free in 12 months. So let me show you those results in a graph. Does everybody know what the Gleason score is? Basically the biopsy where you're looking at the cells, and I put the little chart up here. If your Gleason score is a 5 or higher, that's prolific cancer, okay? Our average Gleason score, remember, was a 6.45. These are basically stage 4 cancer patients that we're looking at, prostate cancer, right? Everybody knows what PSA is. I don't need to explain that either. So here was the graph of the average PSA at the start, dropping down to a 1.47. The average Gleason, 6.5, dropping down to almost a 0 after 12 months. This is the average with the best and worst. The best is the green. There was one patient who had a PSA of 55. Dropped down to 0 in 6 months on GenEpic. The worst had a PSA of, I believe it was just under 3 or something like that. Their PSA didn't change much, actually increased slightly at the end of the study. This was the worst responsive patient, right? With the average being right here, the yellow line. Our Gleason grades, though, which actually is the biopsy, average was right here, the yellow, 6.5 to almost a 0. Our best case was there was a patient with a Gleason of 10 who dropped to a 0. And then our worst response even responded. So everybody responded to GenEpic in the clinical study. In fact, of the 60 participants, 58 of the 60 participants were in complete remission in 12 months, just by taking 2 packets of GenEpic per day. No surgery, no hormone therapy, no chemotherapy, no radiation. Just GenEpic. The 59th patient had a 50% or more reduction in the Gleason score. So almost all of the patients responded to GenEpic. Only one patient had no response. But his Gleason score and his PSA didn't change after 1 year. I mean, he should have been dead, right? But he wasn't dead. So if you ask me, that was a response. Then we asked the patients about their side effects. So before taking GenEpic, these patients were on hormone therapy, or they were doing other types of therapies for their cancer. And before GenEpic, you can see how many side effects they were getting from their traditional therapy. Of the 60 patients, we had over 400 different types of side effects. So many of the patients were reporting multiple problems with their therapy. Well, on the first month of taking GenEpic, this number of over 400 side effects dropped to less than 200 in the 60 patients. And they were mostly mild side effects like fatigue, headache, stomach ache, things like that. By month 3 of the 60 patients, only 38 complained of mild effects to the product. And by month 12, none of them had any effects. In fact, most of the patients said once they started taking Genepic, they felt an increase in energy. They felt an increase in libido. They felt an increase in their sleep time, refreshed when they wake up in the morning, things like that. So we did a study also in Penang, Malaysia in 2001. We had 210 stage 4 breast cancer patients, MDR patients. This was, Mount Miriam has a hospice care center inside the hospital where, you know, basically the patients, after they've gone through chemo, radiation, surgery, whatever, they're non-responsive to chemotherapy. It's called an MDR cancer, a multi-drug resistant cancer. So these were volunteer patients who were basically in hospice. They were there to die. Dr. Lee Chu Ai, I met her at a symposium in Malaysia in 2000, and in 2001, she decided that, or convinced the hospital to at least give these hospice care patients their 2 packets a day of Genepic. There's nothing else we can do for them, at least let's give them the Genepic. She convinced one of the doctors there, Amir Datak, to do that in hospice care. 6 months later, we had 178 patients that showed no signs of cancer with the biopsy and the MRI. Sorry, it was an MRI I think they used, yep. 24 patients had a 50% or more reduction of their metastatic cancer, and 2.3% of the patients worsened or death occurred. Again, amazing results. This was our Mount Miriam Hospital study. So you can see in the chart here, of the 210 participation, if you total all of these up, we had over a 93% response rate. Unheard of in MDR cancers. There is no therapy out there that I've heard of that does that. And it correlates with our FDA study with prostate cancer. We had a 93% response rate with prostate cancer. Again, 58 of the 60 patients in the prostate cancer study went into remission. So about 2 years ago, we introduced Genepic to Japan. We recruited about 35 doctors throughout the country. We've had about 300 patients participate. I'm just showing you the results from 2015. We haven't compiled the 2016 results, but in 2015, we had a total of about 110, 115 patients that had been on Genepic for longer than 6 months. 13 of them had prostate cancer, 33 had breast cancer, and 85 of the patients had other types of cancer. 3 of them were pancreatic cancer, stage 4. I know there was a couple of brain cancers. We actually have a testimonial later on in a slide from one of the brain cancer patients. 16 of the patients died within 2 weeks after receiving the products. Again, the physician that started this study, his name is Dr. Shirakawa. He runs a hospice clinic in Tokyo, again, where his clinic mostly helps patients get their financial affairs in order, informs their family that the patient's going to die. He gives these patients basically just care and love and support. And that's what his clinic has traditionally done for over 15 years now. Well, he started using Genepic, and instead of just caring for their financial needs and letting the patients know that they were going to die, he actually started checking patients out. They were being cured, but 13 or 16 of them did die. But you can see the success ratios, even in hospice care, we were getting in Japan. And these were with stage 4 various types of cancers. So this was our lowest right here. And again, it's because of those 16 of them die. I mean, it was already too late. You know, they started taking Genepic and within a few days they passed on. So this is an ongoing study in Japan right now. We don't have all of the results, but we also want to open the study up here in the Philippines, and we're starting our study in Singapore here in the next few months as well. So if you evaluate these 3 studies overall, here's the results that we're getting. 2 glasses, 2 shakes of Genepic per day has a significant improvement. I mean, we talk about significant improvement in death rates in most clinical studies. Well, how about a cure rate? I know we can't use that word openly, but we can certainly say remission. We had on average over 90% remission rate with the Genepic by blocking ATP. Take the energy away from the cancer cell and the cancer goes into remission. It's simple, simple, simple. Can't say it any other way. Dramatic improvement in patient health. So I added about 116 support ingredients to Genepic. There's 130 some odd ingredients total in Genepic, all right? We added immune support, so the beta-glucans from maitake, reishi, shiitake, mushroom, astragalus. We put detoxifying supporting ingredients in there, including milk thistle, so we have silymarin. The list goes on and on and on. We have vitamins and minerals in there. And again, as a pharmacognosist, which is ethnobotany and organic chemistry, I don't believe in synthetic isolates, okay? Even vitamin C, I try to take in natural form, which is calcium ascorbate or a sodium ascorbate. I don't really like ascorbic acid. There's studies that show it leaches calcium from the bones and things like that. But of course, if you've got a cancer patient, ascorbic acid is much safer than chemotherapy per se if you're going to be doing IV therapy, all right? But I believe in whole foods, so Genepic is a lot of whole food nutrients. But we have the acetogenins in there and faffic acids and suma. Faffic acids contain the B17. So by combining acetogenins with these supporting nutrients, we're not only blocking the ATP synthase enzymes so that the cancer cells can't multiply and reproduce, they have no energy, but we're boosting the immune system and boosting the cellular support for your healthy cells as well. So you combat cancer in 2 ways. So we had drastic improvements in the energy levels of our cancer patients. Their appetite increased, so they wanted to eat again. They wanted to do their hobbies again. And of course, reduction in treatment cost. In our dinner presentation, I'll show you what the average cost. Again, in the Philippines, I don't have that data, but in the United States, the average treatment out-of-pocket costs for chemotherapy is $7,000 a month. That's after insurance pays your 80%. So Genepic is a dramatic, actually it's cheap. I don't want to use the word cheap, but Genepic is cheap when it comes to chemotherapy. It's something easily Filipinos can afford, all right? Even your middle class Filipinos, maybe even some of the lower class Filipinos, is if they get their family to pitch in, okay, can afford this treatment. It's very inexpensive. I don't need to cover this slide. We all know that conventional treatment, you know, if your patients choose to do that, of course they can do chemotherapy, radiation, surgery. Genepic has no contraindications. It's a simple ATP inhibitor. If you want to block energy production to cancer cells, take Genepic. And if you want to go ahead and use cytotoxins such as chemotherapy, go ahead. There's no contraindication between the two. If you want to do radiation, in fact, there's lots of antioxidants in Genepic. We have lutein and resveratrol and vitamin C and, you know, dozens of others. Bilberry extract, we've got tons of it in Genepic. So if you do radiation with Genepic, you'll probably be at least helping boost your immune system and helping protect your healthy cells from the effects of the radiation. So you can take Genepic along with conventional therapy. However, if you look at our clinical studies, why? With GenEpic alone, you're getting an over 90% remission ratio. There's no need to do conventional therapies. But there are lots of studies showing that, you know, by taking GenEpic or taking vitamins or antioxidants with chemo and radiation are beneficial. In the United States, there's over 50 human clinical studies showing that taking antioxidants help the patients with their treatment. There's over 15 human clinical studies involving 3,738 patients who took non-prescription antioxidants with their chemotherapy and had increased survivability. I'm not going to get into these either since we're running out of time. What is our time at? Amar, is it 5 o'clock? All right, we'll cut it short here. These are just testimonials. I had one of our Japanese, this was, I think, brain cancer. They sent me a letter. We can read that in the presentation next door. It's very touching, though. So this is the end of my presentation in here. Again, if you'd like to know about the treatment protocol, how we're going to be doing the clinical study in the Philippines, and if you want to be a participating physician, please join us for dinner next door. Dinner starts at 6 p.m. and we'll cover the rest of these slides. What is the GenEpic protocol? What are all the ingredients in GenEpic? How can I become a participating physician? What's the cost to my patient? What's my compensation for being a participating physician? All of those questions we can answer in the room next door during our dinner presentation. Thank you very much for your time tonight.